risk factors and preventative measures are overlooked. DelmarvaLife's Sydney Whitfield tells us just how we can take that step towards skin cancer prevention.
We know that melanoma's incidence is increasing really dramatically.
The summer sun is one culprit. A study published in Cancer Epidemiology found that teenage sunburns greatly increase the risk for melanoma.
I can't tell you how many young women I've had come in with melanoma or more than one melanoma.
If your teen likes tanning, it's time to have a talk. But does that mean you're safe during the winter? The answer is no. People who participate in winter sports are at increased risk for overexposure to the sun's ultraviolet radiation also. UV radiation exposure increases up to 5% with every 1,000 feet above sea level, and snow can reflect 80% of UV light from the sun. Apply sunscreen to all exposed skin, even on cloudy days. The American Cancer Society uses the catchphrase slip, slop, slap, and wrap as a reminder for the ways to prevent skin cancer. And grab a cup of coffee. A 10-year study in the Journal of the National Cancer Institute found that drinking coffee is associated with a reduced risk for skin cancer.
Now, as you might suspect, studies show that those with family history of melanoma are also at an increased risk of getting it.
But what better way to get the rundown on how to prevent ourselves from skin cancer than to consult a dermatologist. Dr. Timothy Pearson is with Anne Arundel Dermatology, and he's here to set us straight about skin cancer risk. Thank you for joining us.
Thank you for having me.
I actually want to start off with some of the facts. Have you seen an increase in melanoma?
I have. I'm at the early stages of my career, so I don't have the length as some of the other dermatologists in the area, but I can say that starting 5 years ago, I've definitely seen an increase in the number of cancer diagnoses, specifically melanoma, in a wide range, the full spectrum from young people to old.
Had you heard about this research about coffee?
I have. It's an interesting study. They followed about 500,000 patients, so a large number, so a lot of data to follow.
Yeah.
And what it showed was that compared to people who drank no coffee, people who drank greater than 4 cups of coffee a day were shown to have decreased incidence of melanoma. The important takeaway, though, is that researchers couldn't specifically say what it was about the coffee or the caffeine intake that accounted for that difference. Maybe lifestyle was different, occupation, less time in the sun, better skincare practices. So though I love coffee, and as a father of 2 is like practically dependent upon it, I don't think that it's an adequate substitute for a good use of a sunscreen.
Oh, yeah, absolutely. Okay, so I have to ask you, the difference between melanoma and other skin cancers, what is it?
Great question. Melanoma is a cancer of melanocytes, which are the pigment-producing cells in the skin. Though diagnosed less frequently than basal and squamous cell carcinoma, it's more serious and has longer-term implications on a person's health. It has a higher risk of going to other organs and even as you stated, 1 person per hour, a much higher mortality rate associated with it, unfortunately.
Yeah. Okay, so here we are in the winter season. We get a lot of clouds all the time. Is this still a problem, getting some sun damage to your skin?
It is. I think that there's a big misconception that it has to be hot and bright, and that's the only time that you get sun damage. We know that in the winter, certainly the sun is still shining, and though that doesn't feel hot on the skin, we're still incurring a certain amount of sun damage. And the clouds do a certain amount to filter some sun, but really it's more the visible light that they're filtering and not the cancer-causing rays.
Oh, okay. Well, talking about the sun, a lot of people like to go out and tan. Is that something that we can do in moderation?
Unfortunately, no. Even the smallest amount of tan equates to a certain amount of damage to the sun that can lead to cancerous change. Tanning beds should be avoided at all times. Studies have shown that tanning early in life is associated with about a 60% increase in melanoma.
Wow.
And that increase continues to get higher the more and more you use the tanning bed. And then also that 5 or more blistering sunburns early in life, younger than 20, so when we were kids, is associated with about an 80% increase in melanoma as we age. So tanning, though it happens and we're all guilty of getting probably a little bit more sun than we should, including your dermatologists at times, it really should be avoided at all costs. So
I got to tell you, the early sunburns has just caught my attention.
And
right
mine
there.
too, yeah.
Okay, so now I'm concerned. Now I'm wondering. I've had those sunburns. When it comes to melanoma, is there anything I should be looking for? Signs, symptoms?
So the published signs and symptoms that we tell our patients about frequently are the A, B, C, D, and E's of moles. So A stands for asymmetry, anything you can't match up and say cut in half and it perfectly matches up.
Okay.
B is borders. You look for regular borders. You don't want to see scalloped borders or borders that you can't really tell where it starts and stops. C is a color variation. Moles should really be one uniform color. You shouldn't have a mole that's jet black on one side, light brown or red on the other.
Okay.
D, diameter is a good one to measure. We typically tell our patients about the size of a pencil tip eraser, which is about 6 millimeters. Anything bigger or getting bigger than that should really start to raise some concern. And E is evolving, so changing. It's growing, it's bleeding, it's itching. Anything that's painful are good warning signs where you should probably go and consult with your doctor.
Wow. All right. So sunscreen is something we use to protect ourselves from the sun, but I go and I look at all those numbers and I'm just like, I look for the highest number. Is that what I should be doing?
Anything that's SPF 30 or above and is marketed as broad spectrum, so it covers the whole gambit of sunlight that can cause injury to the skin, UVA and UVB lights. That's something you should be looking for. I usually tell my patients 30 and above. I don't have any brand loyalty. I tell them the right sunscreen to use is the one you're going to use consistently. So whether it be spray-on or what's called a physical blocker or a chemical blocker, physical being the zinc oxide, if you remember the white nose. Now they make some that aren't quite as obvious. Really anything you'll use. And the key is reapplication. I think a lot of people are good about putting it on once and then we go out and we get busy, whether it be doing yard work or looking after kids at the beach, and they forget to reapply. And the goal is really to reapply with about an ounce of sunscreen every 2 hours. And even though it's marketed as waterproof, once you're coming out of the water, you really need to reapply it.
Right.
And put it on in the winter too.
Exactly. So.
All right.
Dr. Pearson, thank you.
Thank you for having me.
Information. Appreciate that. Wow.
And if you would like more information on Anne Arundel Dermatology, including their involvement in an upcoming race, Strides Against Skin Cancer, head to our website, DelmarvaLife.com. Well, there's art that is seen, and then there is art that is performed. Today, we have both. Still have